Rheumatoid arthritis is a chronic, debilitating autoimmune disease affecting over 1.3 million Americans. It is characterized by joint inflammation that results in progressive destruction of joint cartilage and bone. The past 12 years has seen several new drugs approved for RA. Despite the increase in treatment options, many patients do not respond or are intolerant of currently available treatments. The RA PhysioLab platform is a mechanistic mathematical model of rheumatoid arthritis that models the dynamic interplay of key cell types and mediators in the inflamed joint. The platform represents established RA disease in a prototypical joint and is characterized by chronic inflammation and progressive structural destruction. Predictive biosimulation research conducted in the RA platform is used to evaluate promising new therapeutic strategies within the competitive landscape. The RA platform simulates inflammatory endpoints, specifically the American College of Rheumatology, or ACR score, structural endpoints, including joint space narrowing, or JSN, and bone erosion scores, as well as serum markers such as C-reactive protein, or CRP. Consistent with the Entellus top-down modeling approach, changes in these clinical endpoints emerge from the simulated mechanistic interplay between a therapeutic strategy and the underlying biology. In the RA platform, the underlying biology includes a synovial tissue compartment corresponding to the purple area shown in the central graphic. This is populated with synovial macrophages, fibroblast-like synoviocytes, T cells, and other inflammatory cells. There's a cartilage compartment corresponding to the blue-gray region in the graphic, populated by chondrocytes, and this is the site where the cartilage extracellular matrix may be degraded by matrix metalloproteinases and aggregates. Lastly, there is a bone compartment corresponding to the tan region in the graphic, where the bone is maintained by the balance of osteoblast and osteoclast activities, and bone erosion results from perturbation of this balance by inflammation in the adjacent synovial compartment. The various inflammatory cell populations are recruited to the local environment, activated, proliferate, produce mediators, and undergo apoptosis according to what is known about the particular life cycle of each cell type and the joint levels of the various mediators that regulate these functions. We know that RA is a heterogeneous disease with considerable interpatient variability in both the mechanistic underpinnings of disease and clinical responses. To address this variability, Entellus creates virtual patients characterized by a wide range in baseline measures and responses to approved therapies, as listed here. These include some of the more recently approved biologic drugs, such as adalimumab, an antibody specific for TNF-alpha, and tocilizumab, an antibody specific for the IL-6 receptor. Within this superset of virtual patient variability, the RA platform further distinguishes virtual patients based on phenotypes commonly identified in RA clinical trials. More specifically, virtual patients are characterized as patients with moderate to severe disease who are naive to methotrexate, a commonly prescribed disease-modifying anti-rheumatic drug, or DMARD. Alternatively, virtual patients are characterized as patients whose disease is inadequately controlled on methotrexate, or as patients who have failed anti-TNF-alpha therapy. Entellus conducts predictive biosimulation research in these three virtual populations to facilitate the more rapid and focused advancement of drug discovery and development programs. This includes predicting competitive efficacy of novel therapeutic strategies, predicting structural endpoints to refine the clinical trial design before undertaking the lengthy trials required to assess these endpoints, and identifying multi-analyte biomarker panels which may be validated for patient selection or surrogate endpoints. Entellus evaluates platform predictions by testing against key clinical data sets, defined as Phase 3 clinical trials conducted in RA patients, and measuring clinical endpoints for which the RA platform simulates a corresponding clinical output. As mentioned in the previous slide, virtual patients may be categorized by commonly identified clinical phenotypes. Entellus creates virtual populations that recapitulate baseline and clinical response data for these clinical phenotypes. The key clinical data sets for patients with moderate to severe disease who have not been treated with methotrexate are shown here. These Phase 3 clinical trials have evaluated methotrexate monotherapy, various anti-TNF-alpha monotherapies, including adalimumab, etanercept, and infliximab, and anakinra, the IL-1 receptor antagonist. Virtual population simulation results are consistent with the reported clinical endpoints in these trials, including ACR scores for inflammation, JSN and bone erosion scores for structural endpoints, and CRP for serum data. As new trials are published for this clinical phenotype, they are added to the validation tests. The key data sets for patients with active disease despite concomitant treatment with methotrexate are shown in the lower table. In these trials, the new drug is added to a maintenance dose of methotrexate, depicted here in square brackets. Data are available for anti-TNF-alpha therapies, adalimumab and infliximab, as well as the anti-CD20 therapy, rituximab, and the anti-IL-6 receptor therapy, tocilizumab. Again, validation tests are expanded on an ongoing basis to include newly published data. This last table lists Phase 3 clinical trials published on RA patients who have failed anti-TNF-alpha therapy. In these trials, patients are most commonly receiving maintenance treatment with methotrexate, and the trials assess the clinical efficacy achieved when adding the novel drug. Data are available for both rituximab and tocilizumab. Thus, the Entellus RA platform includes 3 virtual populations consistent with commonly identified clinical phenotypes and validated against the relevant clinical data sets. These virtual populations provide the means to prospectively evaluate novel therapeutic strategies in the clinical phenotypes most commonly included in RA drug development. This summary has provided you with a brief overview of the RA platform, its representation of the underlying biology, and different patient subpopulations. Predictive biosimulation research conducted in the RA PhysioLab platform is being used to prioritize compounds, optimize clinical trials, and identify biomarker panels. For those interested in further details, I would encourage you to visit the case studies on the Entellus website. Thank you and have a nice day.